It's kind of an interesting area in terms of challenges for patients. So when patients are first evaluated for specialty medications, oftentimes them and possibly their caregivers might be going through a reconciliation process with a brand new diagnosis or devastating disease that they've recently just learned about. So that in and of itself can be challenging for patients. And then when therapy is decided upon, oftentimes the way to access these medications is not very intuitive for patients. In fact, it usually is very different from many of the medications that they may already be taking. So trying to navigate through the system and through the processes to get started on specialty medications can be a challenge for patients. And then of course the drugs themselves. Some of them may have a long list of potential side effects or complications. An example of that are medications with REMS, for instance, that are often managed through specialty distribution or by specialty pharmacies. Those medications tend to focus on risks associated with them and kind of underemphasize the benefits of the therapy. So patients may not have a good understanding of what the benefits versus risks are. So some of the things that pharmacists, I think, can do is really be in a position to help guide the process, be very knowledgeable about the process and how to get patients on the medications that they need. And then, of course, have those clinical programs in place to assess the tolerability-related issues or any other struggles that patients may encounter, like injection site reaction, for instance, is a common one that we run across with many of the biologic therapies that we work with. So we have programs in place to evaluate patients on a regular, ongoing basis to see if they're having any struggles with that and to help mitigate any side effects or any tolerability issues that they may have.